So there was a question about what happens if you are not able to keep on LDN. So this person said, I ran out of LDN and did not take it for about a week, and um, and it looks like that by increasing the dose and combination, that it looks like there is side effects of um, in the form of anxiety. So I think there are multiple things to look at. Is that what happens if you stop LDN for a week? So LDN has short life, about 3 to 4 hours, um, and it's but the thing is that it has immune modulatory and neuroregulatory effects which last longer. So when you stop taking LDN right away, I don't think anything big happens. But if you don't take it for a while, and a while actually depends um, on the person. Some person maybe a week out in between refills, and they say that return of baseline symptoms like pain would come back. Some of the people, if the effect was also in decreasing the inflammation from the immune system or nervous system pain, but if that was happening in a, let's say, in a brain, and that inflammation was responsible for anxiety or depression, then those symptoms can come back. Fatigue, those can come back. And I think that that can happen probably within 1 week. And less likely, but there is also rebound symptoms where if you stop it and then there is a cytokine acting out, severe form of cytokine acting out is known as uh, cytokine storm. So if you're off LDN day 4, and if one experiences significant anxiety, and that may be a combination of rebound or returning back to the pre-existing anxiety, and then it's also when you stop. Usually, I tell people not to increase the dose, or talk to your provider, talk to your physician. What would be the best thing to do? I think that another way that may be acceptable, maybe um, break the pill into half if that's an option. If the breaking pill is not an option, I tell them that you can take the content out of capsule and put it in water bottle. Drink maybe a third in the morning, third with lunch, third in the dinner, and probably a week of that, people should come back. The big thing I think you have to realize is that LDN is pretty safe. It's got very safe, um, but it's potent. It's slow acting. It's potent, which means that any changes you can make differences. And then this time I went to conference on LDN, and I met a physician who lectured on hormone fluctuations, potentiating anxiety or making LDN not work as well certain parts of the cycle. So I think that we're finding that LDN is gentler than other medication, but it's not side effect free. So one of the ways you can test if LDN is indeed causing the anxiety, maybe take half the dose, or like I said, take it in thirds, and dissolving in the water. It doesn't taste great, but that's a safe way of doing it. And once you dissolve in water, then taking a half dose is possible. Water ideally should be um, distilled water, but in a day, probably any water will work. And you cannot keep it very long. Probably, even most professional compounding pharmacies no longer than 30 days. So if you're making it, doing it yourself, probably try to use it up, in that day would be the best practice. So thank you so much for the question, and I wish you have a great day.